Testing. Testing. Oh. Testing. Somebody. Oh, you can hear me. Testing. Okay. Great. Great. Oh, Katie. Excuse me. Excuse me. Excuse me. Excuse me. You need to. Excuse me.
Oh,
Over here
really?
so I can hear you, so you can talk.
Oh, okay. I'm sorry.
Leave him, honey. Leave him so he can talk.
Okay. Okay. Oh, yeah.
Are you? Yeah. And so what? Why? What is all that?
This is the stand
For what?
to basically people coming up and then record.
Can you hurry up? Because I'm holding them up. Is this on?
Yeah.
Is he on?
That's the hood that is not behind. But this is the link that you have.
Okay. Well, we're starting, and so you just have to shout out that you're on.
Okay, they didn't put it on my calendar. Okay, I'll do that.
All right. Thanks.
Goodbye.
Thank you very much. Are we ready to start? And Dr. House and Trustee, if you just come this way, we'd appreciate it. Dr. House right here. And we are going to be joined by Zoom with Dr. Peter Hortez. Good morning. I'm Congresswoman Sheila Jackson Lee. I represent the 18th Congressional District. And as well, I am the chair of the bipartisan COVID-19 task force formulated in the winter of 2020 in the U.S. House of Representatives. And our members come from the East Coast, the West Coast, Southwest. And we have been focusing on the fight against COVID-19, which is then the variant Delta, which has been so deadly, and now Omicron, which has been described as the most infectious and by far spreading the fastest that one can imagine. If you talk to your neighbors, they will tell you that 2 in 3 members of their family or their neighbors or their friends have COVID-19 or tested positive, and most likely it is Omicron. Omicron makes up at least 59% of the new cases. And I think that it is evident that we have, maybe temporary, but we have a crisis on our hands. I'm delighted to be joined by the Superintendent of HISD, who has opened the Forest Brook Middle School. And the good news is that we've opened it to everyone, meaning that those who come do not have to be part of the HISD family or live in Northeast Houston. We have the shortest lines, and we are eager to make sure that we are here until every car is served. We've decided to have a no pre-registration. All you have to do is show up, and we're doing multiple tasks. We're giving boosters, we're giving the first and second shots, and we are testing. But we are focusing on the 5 to 11-year-olds, which, as the chair as well of the Congressional Children's Caucus, I can tell you that it is my passion that children are needing to be emphasized at this time. It is announced that there are 53 million cases in the United States. We know that there are over 800,000 that have died, and we realize that in a week's time, we've had 262 new cases from December 22nd to December 28th, which is 10,000 more cases than this time last year in the second week of January. We are, if you will, filled with Omicron cases and filled with COVID-19. I believe that it is important that we focus on children. The reason is that we find in Houston that newspapers are reporting that only 15%, it strikes me as something very dangerous. Only 15% of our eligible children that can be vaccinated are in fact vaccinated. Doctors will tell you that an unvaccinated person is the kind of home that the viruses look for, because their main purpose in life is to live. And they find homes by being unvaccinated, and that means you get the variant, Delta, and you get Omicron. And so I think it is extremely important that we focus today on children. We've asked families to bring their children to be tested, and we're also vaccinating children, especially in a separate location. 5 to 11-year-olds can walk up, and we will vaccinate them in a totally separate area. So families, please bring your children to be vaccinated or tested. But it is true that it is the little children that can be the carriers, and they can be asymptomatic and cause a great deal of stress. There's a 50% jump of children needing to be hospitalized. And over the couple of weeks, we have heard from Dr. Peter Hotez, who we're very grateful for his leadership, and also the discovery of a different type of, if you will, vaccine that can be utilized in developing countries. One of his messages, of course, is as the world is unvaccinated, we will continue to see different variants coming. So I'm here today to have a special emphasis on children and families. That's what we've said. There is a major crisis, and the major crisis demands that we respond, and we respond in the manner of getting vaccinated and as well making sure our children are vaccinated. The other point of what should happen is I want our nation's medical agencies, our health agencies, to have a special focus on children. I'll be introducing the the Children's COVID-19 Prevention Act in the United States Congress, and that is to instruct health agencies around America to have a special focus directed by HHS with materials printed, with information reached. We just saw a young man who was physically disabled, so he is like a child in terms of his condition, and he was frightened of the testing. I have seen children be frightened of the vaccination. Many people will say that families have vaccinated children. Yes, they have in the early years, but when you get children between 5 and 11, there are sometimes gaps of their vaccination. I want these children to have a circumstance where there is a special emphasis, a special leader, a special focus on how you test and vaccinate children. That can provide the increase from 15% in the 4th largest city in the nation. Can you believe we have 15% of our children that are vaccinated? That is not making us a healthy community. And it is hard work for our hardworking educators as well. But I applaud them for keeping the schools open and working as hard as they can. But we need to help them. We need to work as federal government, as Health and Human Services, as health agencies that receive federal funds, and we need to focus on these children across America. We need to have particular print materials and particular ways of encouraging our children to take these tests. The other finding that we're determining is that children are being, if you will, hospitalized, those with underlying conditions, but healthy children are being hospitalized as well because it is highly transmissible. Children, even with some being vaccinated, we know that Omicron proves to be extremely infectious. So today is my clarion call on a major crisis among our children, and to reemphasize that we as adults can take care of ourselves by getting vaccinated and not be proud of numbers like 55%, the state of Texas, or about 60% in the United States, lower in some states like Arkansas and other states. That does not help us get to the idea of the COVID-19 vaccination or the COVID-19 pandemic coming to an end. We're into our second year, going possibly into our third year. We started in 2020, it's 2021, now 2022, that's almost the third year. So my call today is for all of us to make a special emphasis on our children. If we get to that point where we can say our children are vaccinated, we're on the road to making great strides. I'm delighted this morning to be joined by Dr. House, who was gracious enough, along with the principal of Forest Brook Middle School, to open the doors to me again. We have been here before, and we think it is important that we are in schools to make people aware of the opportunities that our schools offer so that our children can come back safely. I'm proud of the record that he's had with his faculty and staff, but also the leadership that he is leading on in terms of helping our children. Superintendent Millard House, thank you.
Thank you, Congresswoman. I dearly appreciate you, as many in this community continue to appreciate you as we keep our community safe. In HISD, as many of you know, safety will continue to lead the way as we prepare to welcome our 194,000 students back to the school and staff back to the work environment on Monday. As we prioritize safety, HISD's mask mandate will continue to be in effect and will be enforced at all district offices, facilities, campuses, as well as our school buses. To keep our school and work communities safe upon everyone's return, we strongly recommend, as the Congresswoman indicated, that individuals that are coming back into school environments get tested, and more than anything, move forward if their health allows for them to become vaccinated. We continue to expand our partnerships with community leaders, health officials to provide additional COVID-19 testing and vaccination opportunities for all of our families. I'm very proud to say that between 70 and 75% of our 27,000 employees in HISD are vaccinated. And that number very well could be higher, as those numbers were provided to me about 2 weeks ago. As you all know, as Congresswoman Sheila Jackson Lee indicated, we're providing COVID-19 testing and vaccinations at this site. She indicated the emphasis is on five-year-olds and up here at Forest Brook and beyond. We will be here, as she indicated, until 4 p.m. or until the job is done. We will also have PCR screening testing opportunities on Thursday, December the 30th, from 8 a.m. till 12:30 p.m. at Sam Houston High School and Del Mar Stadium, and from 1 p.m. to 4:30 p.m. at Cashmere High School and Lamar High School. Also on Sunday, January the 2nd, we will be providing drive-through PCR screening testing from 8 a.m. to 12:30 p.m. at Chavez High School, Westbury High School, Westside High School, and from 1 p.m. to 4:30 p.m. at Bel Air High School, as well as Worthing High School. HISD will be offering COVID-19 PCR screening testing on campuses to HISD students and staff starting in January. As cases surge, we must continue to work together and do our part to ensure that everyone in this community is safe. Again, thank you, Congresswoman Sheila Jackson Lee, for your continued leadership in ensuring that our community is safe as we can be.
Superintendent, thank you again for being the right kind of partner, and I certainly want to acknowledge wonderful partners that are with us today. In particular, I want to acknowledge Rain Eatman, who is here on behalf of Councilmember Jackson, who is a real partner to me. We're in her district, Councilmember District B, and I want to thank her personally for being on the front lines, hoping that she is now having a speedy recovery. I know that we'll be seeing her, but our office continues to work, and we are grateful for you, Rain. Thank you so very much for being here. We are delighted to be joined this morning with a doctor that I have the opportunity to talk often to. Now the nation and the world is well aware of the expertise that we have in Houston, Texas, with Dr. Peter Hortez, MD and PhD, who certainly his renowned record is now internationally known. He is a professor of pediatrics and molecular virology at Baylor College of Medicine, where he is also the co-director of Texas Children's Center for Vaccine Development and endowed chair in tropical pediatrics. He is also a vaccine scientist, and a new Texas children COVID-19 vaccine is being now accelerated. It has now been approved in India, and it is now ready to, be utilized in India, one of the largest populated countries in the world, and who saw the devastation of COVID in the last year. He is now able to utilize that with all of the countries surrounding India as well, including countries in Africa, particularly Botswana. And so he is renowned with a degree from Yale University and the Weill Cornell Medical School, Rockefeller University, and is the author of 550 scientific articles. But we have discussed the really crisis with only 15% of our children being vaccinated. Dr. Hortez, as you hear me, I introduced new legislation, which is the Children's COVID-19 Prevention Act, which is to cause the focus in the nation's public health centers, just like Texas Children, on materials and approaches to encouraging parents to get children 5 to 11 vaccinated, and as well to be able to provide comfort materials for children who are somewhat frightened, which encourages parents not to get them vaccinated or tested. And we just saw an example of that in the drive-through testing that we're doing, that some persons with disabilities and childlike were frightened of the testing process. So we need to focus on our children, but I'm delighted that you are here. Dr. Hortez, please, would you make your presentation? I'll hold the mic up to you. Thank you and welcome you so very much.
Well, thank you very much, Congresswoman. Am I coming through okay?
You can go ahead.
Okay, can you hear me?
Yeah.
Assuming you can hear me. Well, thank you so much. I think one of the things that we're seeing now with the Omicron variant, in some ways is not too different from the Delta variant. And the Delta variant, when it went through Texas and the southern states over the summer, it affected a lot of children. And so children were hospitalized in unusual numbers across the South in Texas, and even in our Texas Children's Hospital. I don't think it was because the Delta variant was selectively targeting kids. It was more of the case that they were just getting swept up in this virus blizzard or firestorm that we've been seeing with Delta over the summer. Now it looks like it's going to be even worse with Omicron, and we have some hint of that from South Africa and the UK, and lots of pediatric hospitalizations. And I don't think it's the case that Omicron is selectively targeting kids. I just think there's so much transmission going on that kids are getting swept up alongside it. So I call it a firestorm. My friend Mike Osterholm calls it a virus blizzard. Get the idea that we are now seeing a lot of children coming into the hospitals in New York City and Washington, D.C., and now going west into Indiana and Illinois, where Omicron is at its worst. And eventually it'll come down here to the southern states in Texas yet again. We would expect it as we move into January that we could see another rise in cases here in Texas due to Omicron. We're already seeing the beginnings of that. and we'll start seeing some pediatric hospitalization. So I think the message is that, you know, there's a narrative out there that tries to make the case that Omicron does not affect kids. Some people even disparagingly call it Omicold, saying that it's making a claim that it's not severe. It's not the case. We are seeing a lot of pediatric hospitalizations, and it is very imperative that we get our kids vaccinated. Earlier this year, we had approvals for the adolescents, for the 12 to 17-year-olds, and now we have step-down studies showing that it's safe and effective for kids 5 and up. So we are, as the Congresswoman points out, we are not doing well in terms of the percentage of our 5 and up kids who've gotten the vaccine. Now's the time to do it before Omicron gets here in an even bigger way. So there's still that window period to immunize your kids, and that's why we're here today during this very worrisome time when Omicron is accelerating among our pediatric populations. And it's as important to vaccinate our kids as it is to vaccinate our adults, and that's the message for today. So I'll turn it back over to you, Congresswoman, to see if you have any thoughts or if there's any specific questions.
Thank you, Doctor. If you can hear me, yes, I'm going to introduce Trustee Kathy Buford Daniels, and then we're opening up for questions. And I know I would be interested, as I indicated to you, intend to introduce the Children's COVID-19 Prevention Act, which again is to produce sensitive materials in our public health agencies with HHS to try to get parents more comfortable about the 5 to 11-year-olds being vaccinated and or tested, and to be able to have a sensitive approach to how we can vaccinate and test, and also what is the most comfortable areas for these parents to bring their children. I've had, for example, a children's festival where there's a lot of other activities going on at the same time that they're vaccinating or having the ability to test. But the 15% number is stark, and as we watch what is happening into New York, I think we should be concerned about what might happen here in Texas. So let me introduce our trustee, Kathy Buford Daniels, and thank her for being here.
Thank you, Congresswoman. As always, thank you for the opportunity to serve this part of town, the least and the lost in most cases. And so we're going to ask that as you all broadcast this, please remind people we need our children in school. And in order to continue with that, they need to get vaccinated. Our children out here on this northeast side are struggling the most with learning loss. So we need our children in school. And again, please remind people this is an opportunity right here in our community. You don't have to live out here. Just bring your children out here to get vaccinated. Thank you.
And as we've indicated, we're bilingual, so parents, please know that everyone is welcomed, because we are in, trustee, some challenging times.
That's right.
And as you indicated, we are welcoming people from all over the city. The one good news I want to say is that the wait here is continuously moving. We're very grateful for that. I want to thank UMMC for their work in helping to move these, what we call neighborhood centers. That's what this is. We brought it to the neighborhood so that you could be blocks away, you could be a few miles away, and you could come to this open area, as well as our special site that we have for children 5 to 11-year-old. We have a special site for them. So please make sure that you take advantage of it at this time. So I will open it up for questions, and as well make the further note that the infectious nature, let me just be very clear, the infectious nature of Omicron is going to spread to activities here in Texas. Broadway, parts of it are shut down. Restaurants in New York are on a very cautious schedule. We are seeing it, as Dr. Hortez says, move to the Midwest. And we know that when it was in COVID-19, it was New York, it then hit New Orleans, it hit Detroit, and it does hit populations that sometimes are impoverished. It hits everyone, and it hits communities of color when you don't have access to health care. That's why we come to neighborhoods where people can just get up and go a few blocks. But we are not taking any zip codes. Anyone can come to Forest Brook Middle School today. That's why I want to again thank Houston Independent School District for its hospitality. I don't know if any people see, we haven't built schools like this in recent years with all of this land. And I just knew this was a wonderful place to come, an easy place to get to, and we hope people will continue to come. So we'll take questions at this time. Okay, who's?
Superintendent, what changes are you guys making to the comeback of the school year for HISD?
You know, there are not very many changes. I think we've done the best job possible in reference to mitigating the COVID-19 strains that we've seen over the course of the last couple of years. Probably more than anything, and that's a question that many in our community have had, is what we're doing in reference to our mask mandate. We did indicate about 2 weeks before the Thanksgiving break that we would revisit the mask mandate. And we indicated that simply because we know that there has been a ongoing trend that after holidays we've seen spikes. And after the Thanksgiving holiday, which is pretty much where we are right now, we again saw a spike. So it's safe to say that's why we are moving forward with the continuation of our mask mandate. Now we hope and expect that the cases will be on the decline over the course of January and February, and we can revisit it at a different time when it's safe. But what's important for our community to know is that we've worked very hard with one of the lowest positivity rates in COVID-19 in the state of Texas, especially being the largest school district in Texas. So we'll continue doing the work that we focused on to ensure that our community is as safe as possible.
Superintendent, I also had another question for you. What is the current situation with teacher shortages and staff shortages? Is that going to be an issue as more and more people start to test positive?
So the question was, what is the status of staff shortages in reference to COVID-19? And right now, of course, we're on a break. It really depends on what our staff, what our students do as they come back. Many of our individuals in our community have traveled. So we're encouraging them to move forward and get tested. So depending on what happens in reference to the positivity rates of individuals, and that's one of the reasons why we will be having testing as well as vaccine sites throughout the school district. So our hope is that we don't see major shortages, but if we do, we will look at sites individually and not a district as a whole. So if we have high positivity rates or high transmission at a particular grade level, in a particular wing of a school, we'll look at it from that perspective. We have to continue to keep our education system open. That is my hope. That is my expectation. But at the end of the day, what's most important, of course, is the safety of our staff, students, and community.
Let me just comment on that because of the experiences that we had and that all of you have lived through. The circumstances may force us to act. That's what we're trying to avoid. The circumstances of 2020 forced us to act. It forced the closing of schools. We didn't have vaccinations. We only had testing, and I'm sure that our children were not tested at a high level. So if family members had it, children would have it. Or children would have it and family members would have it. If the circumstances, that is what we'll be dealing with when we go back to Washington. If the circumstances are such that Omicron is so infectious and that it takes hold of so much of the infrastructure of truck drivers or medical professionals or educators, then we have to respond. One of the reasons why I brought up the idea of children is because, again, I'm repetitively saying and shocked that our number is 15%. And that is not for trying, because we know that Texas Children's Hospital has been working. We put a focus on, when I say we, various clinics have put a focus on children, but it's got to be the parents. So circumstances, I know, is going to cause even the federal government to assess how do we address the concerns of parents, the concerns of workers, the concerns of the ability of the country to run itself if Omicron becomes the dominant force, so contagious that people are in important places. When I say that responsibilities, they have Omicron, and there are not enough substitutes to substitute for them. That's what we need to be concerned about. May I just ask Dr. Hortez, and I will get your question. Dr. Hortez? Dr. Hortez? Can you hear me? Are you on mute? Can you hear me?
Yes, I can.
Right. The question is coming to the superintendent about trying to make sure that the work that he does, or he is emphasizing the work that he does, is to keep schools open. And I would just note the concern that Omicron is so infectious that how do we prevent a situation where we are short of teachers, we're short of nurses, we're short of doctors, we're short of truck drivers because of the infectious nature of Omicron. You want to comment?
Yes, yes, this is going to be the biggest problem, and I'm being asked about this now regarding what Mayor de Blasio in New York City just announced, that they're going to open come hell or high water starting June 3rd, and they asked me about it, and I said, well, right now in New York City and Washington, D.C. are the epicenters of this Omicron wave, and it's hard to know. When you've got something this transmissible, I think you have to be pretty humble and recognize that there may be limitations. So the schools are trying to use their experiences with previous virus lineages, like Alpha and Delta, to get a sense of how things will go with Omicron. And Omicron is so much more transmissible that it's not clear to me that we can extrapolate to that extent to say, well, we got away with it with the original lineage in Alpha and Delta, therefore it shouldn't be a problem for Omicron. Omicron is quite different, so it is going to be pretty complicated. I actually recommended for New York City to kind of hold off the opening a week or two in the hope that this big wave goes down as quickly as it goes up, but they're going to move forward. So we'll learn a lot to see how things are going in New York. Eventually, things should get as bad in Houston as they are in New York. I think we probably should count on that. So I think we're just going to have to take it week by week and try to keep schools open, but recognize it may become necessary to go virtual for a week or two as we head into the winter, depending on the level of transmission, both for the kids getting sick as well as the teachers and staff, because that could be very destabilizing. So I know, the school teachers and the principals and the staff are doing everything they can to ensure that the school year goes according to plan. But it's asking a lot, because we do have depleted healthcare infrastructure across the state of Texas, much better in Houston and Harris County than the rest of the state. But what's happened is, with all the cutbacks in health departments in different parts of the state of Texas, what's happened now is we're balancing this in the back of the schools. We're asking the schools to become mini public health agencies and figure out how to do the testing and health infrastructure, which is quite unfair. The good news is Harris County and Houston, things are much better set up. We have two very strong health departments to help us through this. But so I think I feel more confident about what will happen in Harris County and Houston than the rest of the state. But no question, we will be in for tough times. The good news is it does look like the Omicron variant is starting to subside almost as quickly as it went up in South Africa and the UK, and the hope is that happens here, so that if the social disruption, while it'll be significant, will not be long lasting. So, but you never know for certain until we know.
Thank you so very much. Yes, thank you.
This question is for you, Congresswoman. I covered a story yesterday in the Cypress area where a number of people showed up to a particular testing site, and they say they've been waiting more than a week for their test results. It was a very obscure trailer, unlike the site that you guys have here today. And they're concerned today because they gave away their social security number, their driver's license information has been uploaded, and they don't know who these people are with their
And I want Dr. Hortez to be able to comment on that as well. Let me just say, as a regulator, as a member of Congress who has advocated for the American Rescue Act and the CARES Act, those are both federal funds that have come to city health departments, county health departments, state health departments, and of course, public schools. I prefer to encourage individuals to go to those kinds of sites. The sites that are being run, even if there is a long line, by some governmental entity. So you're here on school grounds, and you have the name of the tester. You're not going away without a name. You're not going away without a phone number. If you're at Del Mar, you're not going away without a number. I would want to know at least the location, because it should be investigated. And the first thing that they might want to do is, if it is in the county, they can report it to the sheriff's office. They can report it to one of the constables, whatever constable area it was in, if it was Cypress. And if it's in the city, I'm sure they can report it to HPD, because certainly we want people to be helped. For all we know, the testers may have been trying to help, but if they do not have the adequate resources, then we can't have people not tested or not getting their results quickly. So I would just make the point that they should, one, I hate to say it, try to get to a facility run by county or city as quickly as possible, or the site that we have, we're open on HISD grounds, but we have a vendor that name is well known, has a phone number, is not hiding, and that's what they need to do. At the same time, we should be aware of individuals or entities. They may mean well, but if they are disappearing and you can't get your results, that doesn't help us fight COVID-19. We want to fight COVID-19 in the right way. And thank you. I think it's an important note to warn people to try to find facilities. They can go to the websites of Harris County. They can go to the websites of the City of Houston, and we thank the mayor, county judge for working constantly. And anything that I do is on my website as well. The information is where it is, phone numbers, and at least access to a public facility.
Could you address the point of the state not regulating these sites? These folks were given a name, they were given phone numbers, and they turned out to be real places, but they were not affiliated with this fictitious site.
Well, the one thing that I would make is that all of this is new. We haven't been dealing with a pandemic since 1918. I think states should have some form of regulation. Mostly the state, since I've worked with the state under their Homeland Security efforts dealing with COVID-19, mostly they deal with county entities. But now that we have a new day, now that we have more people accessing PCRs or rapid tests from some other entity, third party, for example, then it should be regulated. If it's not the public process, then I think it is worthy of regulation. As you well know, regulation can come through the administrative process, but it also has to come through the legislature. I think this is something that we are now learning, and there should be at least a process of standards that can overlay anyone being a good Samaritan. If this trailer was trying to be a good Samaritan, I've seen some in years, in this last year, you drive out and be a big sign in a parking lot, come get a test, and it'd be a big price on it. And I was outraged. Nothing we should do should cost anyone that drives up. Because of the way the federal government has structured it, no one should be charged anything walking up. It's a different thing if you go to your private doctor's office. That's obviously your healthcare system. But you should not be driving up on a random parking lot and a big sign like you're selling flowers or potatoes, and have a price that you have to pay and not know when you'll get that. That needs to be regulated, not know when you'll get your results, because the results are key to keeping the community safe. That's what we're here to talk about. Go to a place, you know you can get your results, or you've got a phone number, or you've got someone that will listen to you calling and saying, I haven't gotten my results. When I've had those incidences, The agencies that we work with, they got right on it and gave that particular person, they could track them down, find out why they hadn't gotten it, told them they'd actually sent it to their phone, and they actually found it. Thank you. Yes.
One more question. This one is for Dr. Lopez.
Yes.
If he could explain that 35% increase, we keep hearing that number for a 35% increase in pediatric cases.
Dr. Hortez, did you hear the question?
No, I did not.
The question is, can you explain the 35% increase in pediatric cases? I know I've seen numbers as high as 50%, but the question is, can you explain that number? Or the number, or the...
Yes, I think it has to do with the higher transmissibility of the Omicron variant overall. I do not think it's selectively targeting kids, as I mentioned. I think this is just creating such a firestorm, such a virus blizzard, that kids are getting swept up in it. And so I think it's just the overall increased level of transmissibility. In the past, I think kids were somewhat protected by the lower transmissibility. Now the gloves have come off from this virus, and we're starting to see lots of kids get sick. So again, I don't think the virus is selectively targeting the kids, but they are getting, it just reflects the overall numbers in total, and a lot of the kids now are starting to get affected, and that's why we're starting to see the pediatric hospitalizations come up. I would expect we're going to see larger numbers in the Texas Medical Center and Texas Children's Hospital of kids, although my understanding from Dr. Vasalovic, who's been looking into this at Texas Children's, that the severity of the illness, while a lot of kids have been getting it, has not been very high yet, but eventually as the numbers go up, we'll start seeing sicker and sicker kids. I'm sorry, increased number of kids who are sick, and so this is going to be something to watch very closely. I think we also should be cognizant of the fact that now we have flu season upon us, so we may see the possibility of co-infections with influenza and COVID-19 among the kids. So we've seen this since the beginning in Wuhan in China, and we should start to see that as well. So it's a reminder also that our kids should not only get their COVID-19 vaccinations, but to get their influenza vaccinations. And we should also note that there has been some downturn in different parts of the state of kids getting their routine childhood vaccinations. And the reason I bring that up is the one we worry about the most is measles, which is the most transmissible. Historically, when we see measles epidemics in the United States, it's late winter, early spring, so kind of March, April. So I'm also holding my breath about potential measles outbreaks in March and April again. So number one, get your child vaccinated against COVID. 2, get your child vaccinated against influenza. And 3, check in with your pediatrician to make certain that your child's up to date with the routine childhood immunizations, including whooping cough and measles and the others as well. And lastly, the other one to watch out for is HPV vaccine for cervical cancer and other cancers. We've seen a big drop off in that as well. So that's yet one more thing to look at. So I guess the message is vaccinate, 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 and vaccinate. Keep your child up to date.
Thank you. Because of its infectious nature and how fast it's spreading, that means the unvaccinated person, adult, teenager, or child, becomes the home to create other variants. It is amazing. I think we've all watched in amazement. Delta has been so deadly. Why is Omicron? Because the numbers in the United States are relatively low. We are not at 70% nationwide. We're 55% in the state of Texas. Again, I say the same number over and over again. We're 15% of the children in Harris County. And so there's a lot of places for Omicron and other variants, which is my great concern, is the potential for other variants. So we're here today, as I indicated, is a separate location for bringing your 5 to 11-year-old to be tested or vaccinated. And we're also giving the first, second, or booster shot of individuals who have already gotten part of their shots. We want to make sure that we make that available as well. This is being done today on the 29th. There's more to be done on the 30th. We even have Reverend Hall, who is doing one on the 31st at Kingdom, and we're delighted that Reverend Hall is here. There'll be one done on 12/31 from 10 to 1, free testing at Kingdom Builders Church, Terrence Hall, and that is 7937 Count Street, 77028. And we're delighted that Reverend Hall is here. We thank him for his leadership. We need to do as much as we possibly can to get this done. Yeah, and so there's a lot that you can find at the different schools. We want to make sure, I'm trying to make sure that we get you before that family sit-down dinner on New Year's Day or New Year's Eve. Please come, and that's just a couple of days away from the reopening of schools, and our educators are trying to do the very best that they can to ensure that your children are in school. Be reminded of how long our children were out and something called lost learning. I also want to announce that the Texas health officials have reinstated, that's why I've called this a crisis standard of care for hospital staffing. They just did it this Tuesday amid the surge of new COVID-19 infections and patients. That's why this is also a crisis for our children, because Texas Health Department has said there's a crisis in our hospitals. Dr. Cortez has indicated that what is happening in New York may come through Houston, come through Texas sometime in January and maybe February. So I'll take any other questions at this time, but I do want to emphasize that we've got 53 million cases in the United States. This is a national crisis. We are now working to produce 500 million doses of the 500,000 rapid tests that we want to distribute to individuals. We expect that we should be distributing them, I hope, in January into February. I want people also to be wary of their home results and to make sure that they check with their health provider if they are in doubt. But we expect to be distributing those tests as quickly as possible. That complements trying to stop the spread of Omicron. And then I want to make sure that we realize that our increase of 262,000 plus cases is 10,000 more than a year ago when we were in the midst of what we thought was a very tough season of COVID-19. We're not free of it. The cases are still here. I want to conclude by just letting Dr. Cortez, I'll give you the last word. If you can hear me. Can you hear me now? Can you hear me? Can you hear me?
Yes, I can, and thank you, Congresswoman. I'm going to have to jump off, but appreciate the opportunity. And again, the message today is that this is as much a pediatric illness as adult illness in many respects, and the urgency of vaccinating your kids. So thank you again for this opportunity, and I look forward to following up with all of you and with you, Congresswoman. Thank you for being such a great voice during this terrible pandemic.
Well, we thank you, Dr. Cortez, for your national prominence. I just want to conclude by simply saying that we are looking very closely in Washington. We rely upon the scientists and Dr. Farsi for the variants anew. What will be next? Are we going to finish with Omicron, or is there going to be another variant? To safeguard yourself against another variant, it is to have a testing protocol that you get tested frequently, but at the same time, please consider getting vaccinated. If you are pregnant, please seek a counsel from your health care provider. Please don't make your own decision alone. Please see a health care provider. Congresswoman Jackson Lee is not going to advise you, but I am advising you to see a health care provider. Those of you with 5 to 11-year-olds, I am going to advise you that the test has been tested, but more importantly, you can also see your pediatric doctor. Let your pediatric doctor advise you. Do not make decisions alone. But it is well noted that children have been utilizing the vaccine And what we've seen to date is a safe utilization by the 5 to 11-year-olds. Many people don't know, as I conclude, is that the research on COVID-19 vaccines did not start yesterday, not even with warp speed. Dr. Hortez has been doing research for 20 years, at least. So researchers dealing with vaccines, they're 10, 20 years out. So these vaccines have been researched and been in clinicals, and I just hope that we will take this opportunity to realize that we are in a crisis. We need to help our children and we need to help our families. Thank you all so very much. We're going to continue to hopefully stay here and get every single car that comes, and we thank you all so very much. Thank you, Reverend Hall. Thank you, Superintendent House, for your leadership. Thank you, Trustee Buford Daniels. Thank you, Rain, and your wonderful council member. We're so grateful for her, and you have been with us all the time. We're very grateful to you. Thank you to my staff as well, and to UMMC. Let me thank them as well. Let's give them an applause, because they never turn anyone down. The Congress, the city, the county, they're always there. So thank you all so very much.